It started with an idea. In 2013, an osteopathic physician saw a problem. New Mexico had one of the highest physician shortages in the country. There simply weren't enough doctors for all the states and surrounding regions' patients. He thought, why don't we train physicians right here in New Mexico? But not just any doctors of osteopathic medicine. And that's how the Burrell College of Osteopathic Medicine was born. But the doctor couldn't do it alone. He needed help. He joined forces with a local community leader and longtime hospital administrator, who, through his long-standing relationships, obtained the support of critically important hospital and clinical partners. Their mission: diversify the physician workforce to better represent the region and nation. They introduced the idea to private individuals and organizations and raised the necessary funds to start the school. The Burrell family provided the initial seed funding, thus the college name. Rice Management Company, who manages the endowment for Rice University, believed in the mission and vision and joined the ownership team as the single largest investor. They teamed up with New Mexico State University, creating the first of its kind in the nation public-private investor partnership. Local, state, and national elected officials also loved the idea. Burrell College received bipartisan support from 2 governors, 2 U.S. senators, and 1 congresswoman. Regional physicians, clinical training sites, and hospitals jumped on board too. More than 600 physicians signed up to educate the future medical students before the college had even opened. The news spread like wildfire. New Mexico's first and only osteopathic medical school would open its doors in Las Cruces, New Mexico in July 2016. The students coming from across the nation would be service-oriented, trained for the people and the future. They wouldn't just learn the science of medicine, they'd learn how to be compassionate and respectful physicians who have a social impact on the communities they serve. Many of them would be underrepresented minorities, helping to diversify the physician workforce. In fact, in 2020, Burrell College was ranked number 2 in the nation for minority enrollment, amongst all 44 DO medical school campuses. Diversity would also be prioritized in the college's Board of Trustees, who represented the communities the college served, as well as the region's top healthcare providers. Together, they assembled an excellent team of faculty and staff, led by recognized osteopathic physician leaders. 4 years flew by quickly, and in 2020, Burrell College graduated its inaugural class of physicians. The years of hard work paid off. The class achieved 100% graduate medical education placement, and more than a third of the class would remain in the southwestern U.S. to help alleviate the physician shortage. What's more, in the 7 years since its inception, Burrell College has had strong academic leaders and educators who ensured that the college obtained full accreditation and had a strong foundation for the future. In addition, the college helped create over 100 new residency positions in New Mexico and the borderland region, bringing even more physicians to the region. More are in development. Never in their lifetime did the physician and hospital administrator who developed Burrell College imagine that medical school would be delivering upon its promise and populating its inaugural graduates into a global pandemic. But because of the Burrell College of Osteopathic Medicine, 133 new doctors are now on the front lines of COVID-19, practicing in hospitals and clinics across the U.S., including many in our region. Because of the Burrell College of Osteopathic Medicine, there are now more doctors in New Mexico and the Southwest region. And because of the Burrell College of Osteopathic Medicine, the future is bright for Las Cruces and the Southwest, as generations of physicians will continue to come, stay, and serve in our region.